said in the last few days. I guess the issue is not everybody said it. I'm not sure that two people have been closer to the progress and the process of the Affordable Care Act than Dr. Tom Coburn and myself. We were in it in committee, along with other members. The fact that I'm not embracing a strategy to threaten to close down the government is real important. It's because at the end of the day, you open the government in the way that the statute is there, Affordable Care Act is still there. I didn't come to Washington to embrace strategies that don't achieve solutions. I came here to find solutions to big issues so the next generation can benefit from it. Now, don't misunderstand me. There's no bigger critic in Washington, D.C. than the senator from North Carolina. As a matter of fact, in the committee, I counted 58 votes on 58 times of amendments we voted to kill the health care bill. I think my record stands for being opposed to this legislation. Senator Coburn and I have introduced more health care proposals than the rest of Congress combined. Options, replacements. We've stood on this floor hour after hour during the Affordable Care Act and shared with the American people why this was a bad move. We've quoted individuals who headed the Centers for Medicare and Medicaid Services, their chief actuary, who told us before we passed that bill in this body that this will close community hospitals. It'll increase premiums. It will deprive people of health care. But the Congress of the United States and the President of the United States signed this law into statute. And there's only one way, once there's a law and statute, and that's to pass a bill that's signed by a president that reverses that. So, to some degree, this is 101 civics. It's an understanding of the legislative process. It wasn't the first time I disagreed with something this body done, and let me assure you, it won't be the last thing. But I also understand the way that we change this, and it's not the way we're attempting to do it right now. So, what have we seen in the short period that we've gone through as we've moved up to October 1 and these new exchanges being rolled out? We've seen premiums go up. We've seen doctors retire. We've seen healthcare professionals move from rural America to urban. We've seen the healthcare infrastructure scared to death of what's around the corner. We've seen premiums rise. Boy, if there's anything that's wrong, it's the title of this bill, the Affordable Care Act. We have made health care less affordable for more Americans. Let me say it again. This act has made health care less affordable for more Americans. It's tripled, at a minimum, the cost of a health care premium for somebody 30 years or under. Tripled at a minimum. A group that is targeted for enrollment in this, and they wouldn't enroll when the premium was a third the cost it is today. Now, we've heard people say that members of Congress are trying to protect their own subsidy. Members of Congress aren't going to take the subsidy. We may pass legislation, but at the end of the day, the public pressure will be such that nobody up here will take the subsidy. But if we're going to treat federal workers one way, then treat all of them the same way. Don't pick and choose who. The ones that work on the Hill, the ones that work in our offices, not the ones that are in committees, not the ones that work at the FDA or the EPA or wherever. Let's include everybody. If you want an exchange to work, then you've got to enroll as many people and you've got to have robust competition. Well, the way this is set up, we're going to have low enrollment. And the way that insurers have responded to the exchanges, in my state, we've got one insurer that has entered the exchange to insure the entire state, and one insurer that is representing 10 counties out of 100. That's not competition. It's almost a monopoly. And I don't blame the one that's in all by themselves. I blame what we designed, where we didn't empower states to actually design things that fit their health care infrastructure in their state. where individuals couldn't buy insurance based upon their age and their income and their health condition. We said, no, if you don't buy this plan, then you're going to pay a penalty. We've heard a lot of debate about the process, but we haven't heard as much debate about the specifics of this legislation. It's bad for the American people. And regardless of the outcome of tomorrow's votes, this legislation is still going to be in statute. It's still going to be implemented on October 1. I hope all the thousands and hundreds of thousands of people who have responded to the request to call, and they haven't always known why, except they don't like this health care plan, when tomorrow's vote's over, don't go away. The pressure has got to be on this institution to make the changes. Most Americans don't know that we're going to start taxing, or we're already taxing, the manufacturers of medical devices 1.5%. They pay a surcharge to fund Obamacare. We're going to charge in the exchanges a 2.3%, I believe, health insurance premium tax for every person that purchases health insurance. Now, you got to ask yourself, if we're going to tax devices and we're going to tax the insurance premiums, how in the world can the price of health care go down? It can't. This is common sense and math matched up. It has to force health care costs up. And that's, in fact, what every American's seeing. Even your employer insurance, if you're lucky enough to still have an employer that's providing it, your health care premium's going up next year. If you're in an exchange, your premium cost is going up next year. Who did it benefit? It benefited individuals that maybe had pre-existing conditions and they couldn't purchase insurance. And you know what the first act of the Affordable Care Act was? It was to create a national pool of individuals with pre-existing condition, and they would all be offered insurance. And what happened? When about 20-some% of them got enrolled, the fund ran out of money, and the one population that this bill was sold to protect, almost 80% of them were left out in the cold with no options. It has failed since the first step. And what I hope is that the American people won't leave this debate and say we've done our best. We haven't done our best. The nation is betting on us to continue on this. Our children deserve whatever it takes for us to accomplish it. But as I started, let me say to the body, our strategy to get there was flawed. I know it sounded good, but it doesn't work. The only way to eliminate a bill that's in statute is to pass a bill and have it signed by a president that reverses that statute. I'm glad we've had this debate. I'm glad the American people are now engaged in it. I don't think this will be the last discussion we have on the Affordable Care Act, and I will assure you that, like I have been before, I will be again on this floor debating my colleagues as aggressively and fairly as I can about what's wrong with this bill and why it should be reversed and why it should be replaced. I thank the President. I thank my